Today we're diving into a topic that affects up to 85% of teenagers and plenty of adults too. Acne and the wonderful joys of the Vesuvius that lies beneath the dermis. Here's the twist. Acne is not just about appearance. It can hit your confidence, your self-esteem, and your mental health. And if you thought it was only a teenage problem, think again. Acne can stick around well into adulthood, especially for men. Now, why should we care about acne? Well, let's be honest, dealing with it can feel isolating and frustrating. Whether it's a few stubborn spots or persistent breakouts, it's not just skin deep. It can really affect your mental health. Studies show that acne can cause embarrassment, anxiety, and even depression for many men. What is it? It is the most common skin condition. It shows up with blackheads, whiteheads, pimples, and cysts on your face, your back, or your chest. I remember it well. But did you know that there are different types? So it's really about trying to get the names for it. You've got comedones. These are blackheads that open, and whiteheads, which are closed. You have papules, which are small, red, inflamed bumps. Pustules, like papules, but filled with pus. And then there's nodules and cysts, which are larger, deeper, and much more painful, and they can leave scars. Why does it happen? Well, there are a few main causes. Hormones. During puberty or times of stress, your body's going to ramp up androgen production, and this tells your skin to make more oil, which then clogs your pores. If you have impaired skin shedding, so this is dead skin cells that don't shed properly, can block the pores and lead to breakouts. And then there's a lovely bacterial factor. So bacteria like Cutibacterium acnes love oily skin and can trigger inflammation. Other triggers include high blood sugar, steroid use, and even underlying conditions that can make acne worse. Now, conventional treatments, what's out there and what can be useful? Most people start with conventional options. So you might be given from a doctor topical treatments like benzoyl peroxide and retinoids to unclog pores and fight bacteria. You might be prescribed oral antibiotics for more severe cases, but do watch out for resistance within your gastrointestinal tract. Isotretinoin is given for really tough acne. It's powerful, but with potential side effects. They can all work, but they don't always address the root cause, especially hormonal imbalances or chronic inflammation. And that's where your herbalist comes in. So beyond the surface, you are looking for more natural root, holistic strategies that can help. And there's a lot that can be done. So herbal remedies like andrographis, burdock root, tea tree oil have anti-inflammatory and antimicrobial benefits. Detox support, herbs like dandelion root and burdock help your liver and your lymphatic system process the toxins and get rid of them. Topically, you could use tea tree oil at about 5% as a natural antimicrobial. Then it would be useful and safe on the skin. Now, contrary to what your doctor might say, diet and lifestyle does matter, and what you put in your body is going to show up on your skin. So you want to reduce refined foods. That's polyunsaturated fats and dairy, because they can spike hormones and cause inflammation. And you want to eat anti-inflammatory foods like leafy greens, fatty fish, and nuts. Supplements. Now, if you are a teenager and you are ramping with testosterone and masturbation is an issue, then you may be losing quite a lot of zinc. And so a supplement in zinc is actually quite useful here, as is vitamin A, which is useful for supporting skin health. But do consult a professional before starting any high doses of those. And then gentle skincare. So often less is more. Use gentle, non-comedogenic products. Avoid overwashing or harsh scrubs because they can irritate your skin, and resist the urge to pick or squeeze the pimples. Trust me, it only makes things worse. Patience, perseverance, and self-compassion. So just take a little bit of time, especially with holistic approaches. Expect it to take 2 to 3 months before you're starting to see any big changes. And that's because we're doing the work inside, not just topically. And allow your body to naturally recover, not just masking over the symptoms. And if you feel discouraged, remember, you're not alone. So do reach out, do share either in the comments below or on the Men's Hub on my website. It's www.thewildsage.co.uk, and you can click on the Men's Hub on our courses section. So acne is common, but it is manageable. Hopefully you find this interesting and of use. If you want to like and subscribe to the channel, we'll be talking an awful lot more about men's health in the days, weeks, and months to come. Cheers.